Everyone, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, bringing to you your weekly dose of wellness here on Healthline. Our objective is to promote good health. And when we say health, it is a state of complete physical, mental and social well-being. We focus so much on the physical aspect that the mental health tends to get neglected. The trend seems to be changing a little bit in developed countries, but however we feel that in Sri Lanka we are still lagging behind. So in our efforts to correct that, today we thought about talking about a condition that is very prevalent and if not detected and treated properly, which can lead to very undesirable and severe effects, and that is none other than the condition of depression. To share his opinion and expert comments about the matter, we have consultant psychiatrist Dr. Sajeewana Amarasinghe, who is working at the National Institute of Mental Health. Thank you very much, sir, and a very good evening to you, and thank you for joining us here on Healthline.
Good evening, Dilshan.
So first and foremost, depression seems to be a very loosely used term amongst the lay community. We see that people saying that, okay, I'm depressed, but in reality what they mean is they are going through a brief period of grief or sorrow. So for the benefit of our viewers, can we explain what is depression really?
Yeah, in depression, in day-to-day life, all of us have our ups and downs. You know, we feel sad at sometimes, and sometimes we feel happy. And if we meet an unfortunate accident, or if we, have some unpleasant happening to us, we might feel sad for some time, but we get over it, right? So in clinical depression, you get persistent sadness. That's what the sadness is pervasive throughout the day, and nothing can really lift your mood up. And this kind of feeling low, and everything looks black. And this is what the classically described mood in severe depression. And in addition, you lose your day-to-day interests in life, and you don't have the energy to do things that you used to do, right? So if you enjoyed music, or if you enjoyed watching television, if you enjoyed reading, you no longer enjoy them. You might do it. You might sit in front of the TV and just sit and watch, but you don't enjoy it anymore. You may not have the drive to do your job. And house-proud housewife would just neglect the housework, and the household will become neglected. So you don't have the drive. So those are the classical symptoms of depression: persistent sadness, lack of interest, and lack of enjoyment, and lack of energy. So in addition, you get additional symptoms also. Your sleep and appetite would get affected, and usually you start waking up early morning. And if you wake up at 6 o'clock, usually wake up at 2 o'clock, 3 o'clock in the morning, and just think about depressive things, ruminate about depression. And your appetite, you might use your appetite, or you will eat just for the sake of eating, and you will lose other pleasures as well. Sometimes a classic symptom is lack of libido. You will lose interest in in your sex life, right? So likewise in depression, you get a range of symptoms, but the most characteristic is this sadness that is pervasive.
So you mentioned a persistence of these symptoms. When you say persistence, is there a specified time period, or how do you describe this? Is there a particular time period that you have?
Now, depression tend to be clinically diagnosed as depression. We generally expect symptoms to be there for at least 2 weeks. But if the symptoms are very severe, we may diagnose it even with a lesser time period. So what I wanted to emphasize is this is not the up and down mood which we always have, right? People do feel sad at times, but 2 or 3 days they get over it. That's more like a stress reaction or an adjustment reaction. But in classically, the depression that presents in the classic manner, the sadness is persistent.
There is one important point that we want to emphasize to our viewers. Depression is not really a day-to-day variance of mood, but it is a combination of symptoms which should persist Like Dr. Sajeewana said, at least for 2 weeks, but in more severe cases we can diagnose clinical depression even earlier. Moving on to the prevalence of disease in countries like Sri Lanka, how prevalent is it in your experience as a consultant psychiatrist? Is it a very common disease?
Yes, out of the psychiatric illnesses, depression is quite the commonest one. Internationally, the prevalence, lifetime incidence of depression is somewhere around 10 to 15%. That means 1 in 10 will get depression sometime during their lifetime. And in Sri Lanka, there are a few studies which have shown lifetime incidence to be somewhere around 8% or 6%. But depression is quite common, and very often depression is underdiagnosed. And many people go through life without knowing that they're depressed, and that is leading to difficulties in their home, leading to difficulties in their workplace, and worse, depression leads to negative thinking. Everything looks negative when you're depressed, and that might lead to a feeling of hopelessness, a feeling of helplessness, and some might start thinking that the only solution is that they have to leave this world. Right? So they start getting suicidal ideas, and there might even be people who attempt suicide and die. Quite a large percentage. Suicide has many causes, but a large percentage of those who commit suicide or attempt suicide have depression. I'm not saying everybody who commits suicide have depressed, but a large percentage do have depression. So identifying and treating depression is an important factor in reducing the suicide rates as well.
Definitely, that is again another thing that we want to reiterate. Depression is a very real condition, and if we don't detect it early and treat it properly, it can even lead to severe consequences like suicide. Now, we see that in society, people tend to associate depression with poor coping skills or weak character. Is that in fact true?
No, that's in fact that's what I said, depression goes undetected. Now, depression in the early stages may not be obvious to the layman, right? So the depressed person might become more irritable than usual. He might not neglecting some of his work at workplace, at home. He might be a little irritable, right? In school children and adolescents, they might start neglecting their schoolwork. Their grades will come down. They will throwing temper tantrums, right? So, they don't look obviously mentally ill, and many people label them as lazy, all right, irresponsible, whereas they are undergoing depression. So, coming to a second point, now depression, anyone can get depressed. Now, many people think I'm a strong person, I'm an educated person, I will not get depressed, which is not true. Depression can come to any one of us. Of course, your coping ability has a place, right? For example, you fail an exam. Some people will get depressed, some may not get depressed. Some will cope with it, some may get depressed. But there is a certain level, if there's a certain level of trauma where any one of us can get depressed. So it is definitely not a weakness in our character. It's a clinical illness, and especially in older people. Now we know, especially in the older generation, depression has a organic basis. So many of the patients who get depressed have small vascular changes in their brain. So people who had never had depression suddenly develop depression in their 60s, 65, right? And this may even herald the start of a dementia. So this idea that it is a weakness of character is wrong, and especially among males. That is why if you take the incidence of depression, it's very high among the females and lower among the males. There are multiple reasons for that. One of it is that males don't come for help. They think this is a weakness. Right?
Definitely. Now, especially in countries like Sri Lanka, we see we have a patriarchal society where a boy venting out his anger or sad mood is told to man up and be strong. But that is not really what should happen. Like we said, depression is a very real thing, and we should understand that even males can undergo this, and we should get the relevant treatment. So moving on, Now, what really causes depression? Is it just a chemical imbalance in the brain as people think it is, and are there other organic causes which leads towards this?
No, the final cause for the depression is definitely a chemical change in the brain. It's a complicated thing which happens at receptor levels. Certain neurotransmitter levels go down, and this resulting in a low mood. That is the final event that leads to depression. But there are many etiological factors that might cause that, right? So, yeah, prolonged stressful lifestyles, prolonged stress, right? Being in a very difficult marriage, difficult job, where you have exposed to prolonged stress. And, for example, it is well known that if you are a woman with 3 children under the age of 15, and you don't have a good relationship with anybody, no good confiding relationships, and you don't have a job outright home, your chance of getting depression is very high. So then what happens? Childhood experiences, child abuse, right? Physical, sexual abuse in childhood, traumatic childhood where we are witness to domestic violence and difficult separations, right? That has a definitely predisposing effect. Then your personality. Some of us are very perfectionist. We have very high moral values. We have high standards, right? And we want everything to be perfect. This is good, actually. Some of those people, they achieve a lot in life. But they are also prone to depression because their standards are very high. So it can be multiple. Alcohol abuse. Alcohol and depression go hand in hand. Sometimes people develop depression because they take alcohol. Of course, it can be the other way around also. When they're getting depressed, their alcohol intake may increase. So there are multiple causes for the depression. But the final event is there is a chemical change, and which can be corrected.
So, like you say, certain traumatic experiences, a traumatic childhood, or bereavement in the family, or alcohol abuse can lead towards depression. Are there any other physical ailments or conditions which can also give rise to depression?
Definitely. There are some hormonal changes, especially the thyroid hormones, and certain diseases like SLE, which do has depression, right? Even postpartum, immediately after childbirth, for multiple reasons, the incidence of depression is quite high. And some of the medication that we take for other illnesses like blood pressure or Parkinson's may lead to depression. I don't want to scare people, but you can always tell that to your doctor. If you're having depression, you can tell the medication that you take, and the doctor will have a look at it, because sometimes medications too can lead to depression.
So that is another important point. It is not just a disease caused by what we tag as being insane, because in Sri Lanka, when we say mental disorder, they tend to stigmatize the whole thing. There's a social stigma attached to any form of mental condition. But as Dr. Sajeewana said, certain physical ailments can give rise to low mood and symptoms of depression. So it is very important and essential that you, our viewers, understand this and take the necessary measures if one of your close circle is undergoing these symptoms. Now, I mentioned social stigma attached with mental health. As mental health professionals, sir, what are the corrective measures that you would suggest for us to normalize the perception of mental health in countries like Sri Lanka?
Yeah, the social stigma has been there because mainly mental illnesses, the symptoms are different, right? Especially in serious mental illnesses. You have behavior changes, and so that led to the stigmatization. The second reason for the stigmatization was actually up until 1940 or 50, we did not have medications for these mental illnesses. The mentally ill was put in asylums, right? And they were just kept there. They tried various things, but nothing much effective. Now we have good medications. In fact, the medication that we had earlier was also very difficult to take. They had very nasty side effects, right? So all this led to the stigma. One is the behavior and the perception that it cannot be treated, right? But now, from the 1980s, 90s, we have developed good medications. and good psychological treatments, which are what called talking treatments or psychotherapies, which can help people with mental illness. And we no longer promote these asylums. Mental health treatment is available at all general hospitals, even in Sri Lanka. All general hospitals, all base hospitals, and even in the private sector, mental health treatment is available. So now, as the knowledge, as people get to know this, the stigma goes down. The second thing that I would like to emphasize is that, this dichotomy of mental illness and physical illness is not really true. Mental illness is a disorder of your brain. So any of us can have an illness in the brain, certain parts of the brain, which leads to this depression or any other mental illness. It's the same as getting a disease of the heart or the liver, right? Or the kidneys. So there's nothing to be ashamed of it, and anyone can get it. And I think little by little the stigma is coming down, and I think mental health professionals, even talks like this, media organizations, have a big role to play in this. Mental illness has a huge impact on society. And if you look at the disability caused by illnesses, if you take the top 10 illnesses that cause disability among the people in the world, the young people, depression is one of the top ones. Cardiovascular comes first and depression comes second. And somehow the mental illnesses, because they hit young people in the prime of their lives and leads to loss of large amount of working years. So it is important that we combat this stigma and encourage people to come for treatment.
Definitely, that is one objective why we have this sort of discussion, so that our viewers better understand what this is about, and that treatment options are readily available, and that you should not be hesitant to seek medical help when you do experience these symptoms. Now, like we said, our objective is to lay out the facts for our viewers. Now, we spoke about the symptoms and what causes depression. Now, let's say a person is experiencing this sort of symptoms and they come to you for help as a psychiatrist. What can they expect?
Yeah. Now, it depends on the level of depression, right? Somebody with mild depression might be able to be managed with psychotherapy, basically talking to them. Maybe they're having some problems, right? So there may be where you can talk about the problems, sort out the problems, exercise, meditation, yoga. There are lots of things, lifestyle changes, that can help people with mild depression. But if the depression is severe than that, to a moderate to severe level, which is affecting their lives, they might need antidepressant medication. So now there are quite safe antidepressants, quite well, which are very widely prescribed in the world, with very little side effects. It's a common myth that psychiatric medications make you addictive. There are medications like this, especially the sleeping tablets like benzodiazepines. But antidepressants are not addictive. Another common myth is they damage their kidney, which is again not true. So majority of the antidepressants don't have anything to do with the kidneys. So I think, so a lot of people have this fear of taking medications that affect their brain. But there are certain situations where you have to take medications. And nowadays the medications are safe. And in addition to the medications, when the depression improves, we can again, help you with counseling and psychotherapy. But at a certain stage, you might have to take medications. And the side effects profile is now much better than what it was.
Right. Now, we spoke of mild depression responding to positive lifestyle changes. You spoke about meditation, yoga, exercise, and then also if it's moderate to severe, then we need to take medication. If a person neglects their depression and if they don't take timely treatment, what are the possible complications that can occur?
Yeah. The first thing, of course, when the depression becomes severe, you might become suicidal. The depression becomes really severe. And that's one reason that you need to really tackle the depression before this. The second thing is, if you get, you might get one depressive episode, and if you don't treat it properly, and you have to treat it, and maybe for a few months more after you are better, you may not get it again. but if you don't treat it properly, you may get it recurrently. One depressive episode is not, depression is not an illness where you need to take lifelong treatment, and it's quite compatible with a normal lifestyle, right? And in fact, if you can, the viewers can Google and see the famous people who have a depression in their lives, right? A lot of people have a depression, and now I'm very happy to see so many, celebrities coming out and saying that they have depression. Now we have a lot of people, although they may not say the exact word, they may say they have mental health issues. And we have recently seen Ben Stokes coming out and saying that he's taking a time off because of mental health issues. He's not the first cricketer. There's so many other cricketers who have had depression, right? So this is nothing to be ashamed of. But if you don't take proper treatment, this might become recurrent. And then your job and your functioning level might get affected.
So we spoke about possible suicidal attempts if the depression is severe. What is the incidence of suicide with regards to depression in Sri Lanka? Is it very common?
Yeah, in Sri Lanka, now, since you're on the topic, suicide rates in Sri Lanka we were like the number one in depression. In 1996, we were the top in cricketers as well as in suicide. Right now, we have come down in both. Suicide, we have come down to number 21. Completed suicides. Right. That's but still it's high. You have two peaks. So one is the younger generation. You see the teenagers and the early 20s. Many of them are not depressed. They have fights with their parents or their boyfriends. Those are mainly lack of life skills, poor impulse control, poor anger control, inability to face problems. Most of these younger suicides are like that. But you get the older cohort in the 60s and 70s, they are mostly due to depression, right? Majority are due to depression, and we don't see them in hospitals because sometimes they do it and they complete the suicide. And also these postpartum suicides, again, majority due to depression. So it has been shown that treatment, education of doctors about depression, early detection of depression and treatment of depression can reduce the suicide rate, right? But of course, in Sri Lanka, the reduction was not due to treatment of depression. The reduction was mainly due to the main suicide attempts were mainly due to insecticide use. And I think the government in the 1990s, they brought restrictions. They reduced the toxicity of the insecticides. And they also banned some of the insecticides. So that led to, and also now they improved the treatment for insecticide poisoning. And now the trend has changed. Now people, instead of taking pesticides and insecticides, they mainly take medicinal drugs. And that change has led to less deaths. Not really due to the treatment of depression.
So the prevalence of the condition still remains the same, or has there been upward trend?
It is same. Deliberate suicide attempts are the same. The number of people who are attempting suicide are actually the same or even higher. The number of people dying are less.
And also when we consider the present context, we see that there's a heavy upward trend in drug abuse. We hear about ice or cocaine, heroin, ganja, you name it, you get it in Sri Lanka. So is there any connection with drug abuse to depression?
It's something worse than depression. Some serious mental illnesses like cannabis. In certain people, vulnerable people, cannabis can induce psychotic kind of change in behavior, mental illness. And ice or amphetamine is worse because chemically it is opposite of the antipsychotic. Dopamine, it stimulates the dopamine receptors and can cause psychotic-like features. And in fact, when you are withdrawing from the amphetamine, you go into a depression, right? When you are on the amphetamine, you get high, but when you are withdrawing from that, when you don't have it and you withdraw from that, you get a depression and even suicide, right? So both these drugs are quite bad when it comes to mental health.
Now, in the current context, we are battling a pandemic. It has uprooted our lives, it has laid off so many jobs, and our normal way of living has turned upside down. With the emergence of this pandemic as a mental health professional, have you seen a heavy upward trend in depression, or has that not affected mental health?
It has. In two ways. It has affected in two ways. First thing, many people who are anxious or naturally anxious and they have really become extremely worried about the illness. So their anxiety levels go up, right? So that has led many people to come to see, not necessarily to depression, but definitely to mental ill treatment, and even to see the anxieties and depressions have been exacerbated. The second thing is the social factors. The pandemic and the lockdowns and the economic recessions have led to loss of jobs, which has led many people to become depressed, right? Secondly, the families are separated. You find the parents, elderly parents living alone, their children abroad, they can't come and see them. So a lot of elderly parents who are lonely have got depressed. And the schooling has been interrupted. Schooling and universities, and children at home, no extracurricular activities, and many children have got depressed, right? And childhood depression, as I told you, may not come with the classical symptoms. Children, when they're depressed and anxious, they become angry more than usual. They neglect their studies, and sometimes, interestingly, they become, they just spend a lot of time with their tablets and the computers and on video games. So sometimes we may think it is because they just as a relief, they spend hours and hours on video games. So superficially, it might appear like he has got addicted to video games or screens, but sometimes some of the children are actually depressed. So depression among children has increased, and unfortunately domestic violence has increased, because sometimes families are forced to stay together. The husband and wife may not be on the best of terms, but now they're forced to be together and on each other's toes. And we have seen that, in fact, a national hospital has a hotline, 1926. That's the National Institute of Mental Health. We have a hotline, 1926. There's also a chat line. Same number.
So it's open for the general public?
It's open. The hotline is open 24 hours. I think the chat line, during the daytime. And
if you can repeat the number, it's 1926.
1926. That is the year that the National Institute of Mental Health was established.
Okay. So 1926, please remember that number, because that is available for you if you are undergoing any sort of mental pressures and you need to vent out, you need to talk to mental health professional. 1926, please remember that number.
And even for advice on mental health conditions, if you are taking medication or advice, you will get a qualified nurse to talk to you, and there are doctors on call who might advise if necessary. So what I was just coming to was, we have seen a spike in the calls we have got, which clearly shows that there are a lot of distress.
And on the other side, we have the healthcare professionals battling it out in the front lines, and there has been a massive upsurge of the workload, and also working in the personal protective equipment. I for myself know that it is very difficult and very draining experience. So we see that so many healthcare professionals also facing what we call burnout, and also may lead towards depression. Have you seen any cases as such where healthcare professionals have gone into depression because of this pandemic?
Quite a few. Not just it's just one is the overwork, the stress, and also the difficulties in managing the situations where a lot of people are dying. We've seen a lot of healthcare professionals, and also especially for nurses and minor staff, sometimes they face social stigma. Their boarding houses, the people may ask them to leave. So the multiple issues are there, and we do see a lot. But unfortunately, some of the healthcare professionals do not come out, and so we have introduced a hotline, which we have. The Sri Lanka College of Psychiatrists has introduced a hotline, so which we have distributed to many of the healthcare professionals in the hospitals. We do see a few calls, but not much. But again, that can be accessed through the 1926 itself. The 1926 will direct you there if it's a healthcare professional. That's a not 7, I think, long number. But the 1926 will detect you there. But unfortunately, the culture probably of calling helplines may not be there that much in our country.
Yes, but as we discussed, we should not stigmatize any form of mental issue, because like we said, we should not say, okay, this is physical, this is mental. It's all part of our day-to-day lifestyle. So as we come towards the end of the program, I would like to ask Dr. Sajeewana, with regards to depression, what would be your take-home message for our viewers?
Depression is a serious condition, serious illness, and sometimes it has comes in different phases. It doesn't just because somebody might be smiling outside, but still he might be depressed inside. So you need to be vigilant, and especially if your loved ones are, there's a change in their behavior. They're more moody than usual. They're more irritable than usual. They're not sleeping as they used to sleep. Their appetite they're not having the usual interests. Their work or school or performances are going down, and you see an obvious change. You need to think whether he's depressed, right? Because by the time it becomes obvious, a lot of things have happened. So if you can pick up depression in the earlier stages, they can easily be treated.
So there you have it from the best. Depression is a very real condition, and it is a condition that can affect anyone. It doesn't mean that you are of weak character. It doesn't mean that you're going insane, and especially there's a big responsibility on families to see if your kids are acting out, whether their behavior is different than normal, or if the elderly, if especially because if not detected early, it can lead towards very severe and negative complications. So as we come to the end of the show, that is the message that we want to bring across to our viewers. Depression is very real. Try to detect it early and get medical help. So until I meet you again next week with your weekly dose of wellness, this is me, Dr. Dilshan Fernando, signing off, wishing all our viewers Ayubowan.